program to me is very important. If it can save the life of one person like my mom, then it's worth it. We live in a county here in eastern Kentucky where we don't think people care about us. The state doesn't care, the federals don't care. We're just part of these hills. And that's a fact. We don't think anybody cares. But this program, when I come into the health department, I talk to Shirley, and she says, we've got this program for you. And I believe Shirley cares about me. She really does.
Because when we wait for patients to develop symptoms, when we wait for them to be obstructed or start bleeding, that's the time when the cost of treating their cancer is dramatically higher. We're saving lives by doing this project. We're touching lives by doing this project. We're starting to mend relationships between patients, physicians, and the health department and the hospital. It's just overall a win-win situation.
The results of my screening were I had 3 polyps removed, and the results came back that it was not malignant, it was benign.
If this program wouldn't have existed, I don't think I would have been able to get the screening because I couldn't afford it.
We are making a difference, and this program is making a difference. We are seeing a decrease in the amount of colorectal cancer in the state of Kentucky. We are seeing an improvement in overall health care because patients, once they agree to come through the program and they have a good experience, then they're more likely to be willing to undergo further testing if needed, or at least establish a doctor-patient relationship, which can subsequently affect their health in a much positive outcome.
The results of my colonoscopy were negative. I do have a condition called diverticulosis, and I'm not in the acute phase, which is diverticulitis, so that's a good thing. No polyps, no malignancies, no blockages, no nothing. I'm clean.
If I hadn't been able to get this screening, I still would not have had a colonoscopy. The polyps that were in there would still be doing whatever they do, and it'd probably be just like my dad and not knowing about it for another 10 years.
The result of my screening was that I had a pre-cancer polyp or mass, that when they took a biopsy of it, it had a high density dysplasia, which is pre-cancer, and it needed to be removed surgically because it was too large to remove any other way. I had to have my colon resection, cut and resectioned.
Because this is what I have decided. It's cheaper to die. This is the truth. You can bury me for less than $4,000 at the funeral home in Martin County. A cheap coffin, put me in the ground, that's it. It's cheaper. I go to the hospital and have this done. I couldn't afford this.
It saved my life. This program has saved my life.
It's important for this program to stay around because there's lots of people like me. There's lots of people that don't have health insurance. There's lots of people that worry that they may have one type of cancer or another type of cancer. And cancer is a deadly disease, and this program is available to those who don't have the health insurance to get tested.
If I hadn't have found out about this program, I think I'd still be living in fear from where my grandmother and my mother both had colon cancer. My mother didn't pass with colon cancer, she passed with other problems, but my grandmother did pass with colon cancer. So if I hadn't found out about this, I'd still be living in fear of if that was my problem or not.
The program's important to me because there's a lot of poor people out there that works every day and try to make a living. And if something's wrong, they can't go to the doctor because they can't afford it. And this program helps out a whole lot. Whole lot of people that tries to make it. Not on welfare enough, and it really tries to work.
This saves lives. This program is important to keep around because it saves lives. I've lost 3 family members to genealogy. Colon cancer has killed people in our family for 150 years. That means it runs in Kentucky. It's not just in my family, it's in all kinds of families. And if we don't do stuff about this, we'll just continue to have the problem. Healthcare isn't just for the rich. Everyone gets sick. And healthcare is not just for the insured, not yet anyway. And so it's just a brighter future where everyone gets the benefit of health, not just those who can afford it.
I have a family history of colon cancer. My grandmother had colon cancer, and my sister has had several polyps removed. So when I was told about the opportunity with colon screening, I felt I should take advantage of it.
It's important that the legislature keep funding these programs for people like me who can't afford to get colonoscopies done. I don't have insurance, and I'm forever grateful for the peace of mind that it's been given me because of this.
I would like to tell my legislators to please continue this funding. Like I said, it's in your best interest financially and for us to have the early screening, because if we do not have insurance to do the screening, then we do not have the insurance to do to do the test to do the treatment. Therefore, if they had found it too late that I had colon cancer, they would have to treat my colon cancer. My husband would be in a rest home. My daughter would have to quit work because I couldn't babysit for my grandchildren. The financial burden of that versus having the test done early, it's just enormous.
I think the story that stands out the most to me is the story of the man whose brother died of colon cancer. I met his brother 2 years ago when I diagnosed his brother with colon cancer, and it was metastatic colon cancer. And I explained to the man at the time, "You need a colonoscopy." And he explained to me that he didn't have insurance. A few months later, we developed this program, and he was the first guy on my mind of someone that was out there just really living in fear that he had colon cancer, and he would lose a pound or two, and he would come into the office and tell me that he was worried that he may have cancer too. This program allowed us to screen him and give him the peace of mind that colonoscopies and colon cancer screening in general usually gives people.
When we meet with patients to talk about screening, initially they're a little bit nervous and hesitant because they've heard lots of horror stories. Most people are not really excited about having to do the colon prep, but there's been a lot of advances in colon preps lately, and it's not nearly as bad as what it used to be. And then now that anesthesia helps us with our colonoscopies, the procedure is relatively pain-free, and patients are much more willing to undergo the procedure.
I think this program should continue. It's a benefit to our patients, particularly patients that are at high risk of colon cancer and patients who are at high risk of not getting screening otherwise. I think it's pretty clear there's a discrepancy in, depending on insurance levels, about whether patients get appropriate screening. There are racial disparities in colon cancer screening that need to be overcome. And beyond just, human suffering, it's also a cost issue, that if you identify a colon cancer in early stages, it costs almost half as much as it does to treat a colon cancer that's found at a more advanced stage. So just as a societal cost level, it is appropriate to do this.
I've had most patients excited to be able to have the opportunity to be screened. A lot of these patients are very concerned. Some of them have had some mild symptoms, rectal bleeding, or a majority, actually, it's not been just pure screening, but a lot of these patients have been having some symptoms suggestive of maybe something going on, or nervous, worried about that, and they've been dwelling on this sometimes for months on end. But basically unable to afford, to have the screening done. So most of them, it's very positive, and certainly when they're waking up and I can tell them, say, hey, everything was normal, everything's good, it's a weight lifted off their shoulders, they can kind of get on with their lives and get back into action.
I think this program should continue because of the need for increased screening to decrease the incidence of deaths, mortality, and morbidity in colon cancers.
I think if this program expanded across the state of Kentucky, we would continue to see a decrease in the number of colorectal cancer deaths. We may see initially an increase in the number of colorectal cancers because we would be screening more patients, but the goal would be to decrease the amount of cancer we would find because we were getting rid of colorectal polyps before they have a chance to become cancerous. And that would be a great thing for the state of Kentucky.
I don't think there's a more important, with regards to whether it should continue or not, I don't think there's a more important program that we have available to our community at this point. When you think about preventable cancer deaths, colonoscopies near the top. When you think about the incidence of colon cancer, Kentucky is near the top. When you think about the rate of screening, we're doing a lot better since we developed the Colon Cancer Prevention Project. But when you think about whether we're screening our patients versus other states, we're not doing as well as all the other states, and we want to be number one, because colon cancer is a disease that people don't have to die from.
I think this program is very important because I don't have health insurance right now, and I wouldn't have been able to get this colonoscopy without this program.
I had not been screened before due to the fact that I never received a referral from a doctor to go and have a colonoscope. It's not something you ask them for, I don't think, unless you're having symptoms. The nurse at the Christian County Health Department offered the program to me, and since I do not have insurance, this was a really good opportunity for me to take advantage of this program.
This program is really important to me, and it's impacted my life because at least for the next 4 or 5 years, I know I'm safe. I know I'm good as far as not having to worry about colon cancer.
But I'm getting to that age. I've had prostate cancer before in '97, and so we had regular doctors up till a year and a half ago. I lost my job. I got unemployment. We got to keep insurance, so that's why we don't have the insurance now, because we've been married 41 years, and that it's we never had no problem with the insurance up to the last year and a half. That's the reason we're here to begin with, because the program does have something good it helps us out a lot.
I would tell my legislators, as they consider funding for this program is that there are a lot of people out there from the ages of 50 to 64 that have no insurance, in the same predicament I was in. And this program can save their lives as well as mine. And I'm grateful for the Jessamine County Health Department that they have provided this for me. And I want to give back in any way I can, so I tell people about it. I tell people about this program.
I told a couple of friends of my age, and you know, I had told a couple of people about this program, you know, my age and my friends, because I think it's very important, because a lot of guys don't, you know, want to go to the doctor because, you know, they scared, you know, that something might be worse than they thought it was.
I think it's important to keep this program around because there's a need for it, not only for myself, but for others who cannot afford quality health care and cannot afford health insurance.
My doctor set up and said it'd be a good idea for me to sit up there and take it, and it was free. And you know, I went on. I was nervous, you know, but I went on and said okay.
If this program had not existed, I would have, both me and my doctor would have lived with the concern, you know, that I could be harboring something that was terminal. And there's always that question. I really didn't know one way or the other. I just knew something was wrong and we needed to look at it. Without this program, I would have no idea.
I think the legislatures should know that this is a very important program. People die of colon cancer all the time. And it's true, maybe our diet is not the best, but when you grow up on soup, beans, and cornbread and fried potatoes, it's probably not going to be the best. That's how I grew up, because that's all we could afford. So it's really important that people have available to them the opportunity of going and having the test done and having the treatment done.